Hello, my name is Marty Jolly, and I'm the Director of Nursing from Dakota Abilities. I want to take some time and talk to you about what a tracheostomy is. An ostomy of any sorts is a hole that's placed into the body. A tracheostomy is a hole that's placed into the trachea. For some reason, at one point in time, a person's airway became blocked, or there was some reason that they couldn't breathe normally. And so some sort of medical professional created a new airway in that person's trachea so that they could breathe in and out without issue. What I'm going to show you now is how this looks when the process is impeded for a person and what's going on for the need of a tracheostomy to be placed. As we can see in our medical mannequin here, if a person ends up needing a tracheostomy, it's because something went wrong in that upper airway. It could be that it got swollen and swelled to the point where it was completely closed. The tongue could swell to the point where it's blocking the airway, or there could be some other issue that's causing a blockage up above. So then the physician will go in and create a new opening between the second and third tracheostomy ring. When that opening is placed, it's basically a hole that's made into there. And then what they're going to do is take a device that's basically like a straw. It's open all the way through the middle, and that is placed into that hole and helps maintain the airflow from the outside world into the lungs and helps the body expel it back out. So without this, that hole or that incision that was created, that ostomy site, would begin to try to close on its own. So the device has to be left in place to keep that site open so that person can continue to breathe. So that's all it is. It is as simple as a straw that's placed into that person's trachea to help them keep breathing and keep their airway open. There are times when a person will have a tracheostomy placed and the issue up above in the airway that was causing the problem will resolve itself and the tracheostomy can be removed and the site can close up. There are other times when the person will need that tracheostomy for the rest of their lives. If you're supporting someone with a tracheostomy, I don't want you to be afraid of it. I want you to realize that it is literally just a straw that's allowing them to breathe in and out just like the rest of us do. But the problem is, their body recognizes that that straw is not supposed to be in their airway, and the body gets mad about it. So then the body builds up mucus and other things to try to tell it to get out of there. You're not supposed to be here. So then this person ends up with a lot more mucus in their airway. And that's something that sometimes caretakers, it can bother them. But really, the only thing we need to do is if that person has that building up, we just need to tell them to cough and expel that mucus out. They can't help it. It's happening because their airway dislikes that device being placed in there. They don't have any control over it. And we just need to help them get it out. As a DSP or a support professional taking care of someone with a tracheostomy, it's important to know if you see any signs that that person is having trouble breathing, you want to encourage them to cough. It could be because something is getting in the middle of that airway and is keeping them from breathing in and out fully. At that point, you want to encourage them to cough deeply. If they're unable to do that, you want to get a medical professional, one of the nurses that's working with you, to come in, and that nurse can potentially suction that to open that airway back up. But coughing is going to be the first thing that we're going to want that person to do to try to open up the airway. So if the person looks like they're anxious, if they're looking at you like they need help, they're trying to cough and it's not working, get help. And then come and encourage that person to cough while you're waiting for the help to arrive. The other thing to know about the tracheostomy is that if you're moving that tube around, that can be uncomfortable for that person. So you always want to be careful when you're helping them with daily cares to make sure that you're not bumping that unnecessarily and causing that person discomfort. It's normal for that person, whenever the nurse is doing cares on that site, for that person to cough because it is going to irritate that person's site. Some of the other risks for this person are that because they're not breathing in through their nose, they can have more bacteria that can get directly into their airway. So they are more at risk for respiratory infections than other people. Once again, minimize movement or touching of the site. Try not to be bumping that when you're helping that person with cares. Encourage them to cough throughout their day. In those scenarios where coughing isn't enough to expel any mucus that's built up or is blocking the airway for your patient, now you're going to need to go ahead and perform suctioning on that person. First thing I want to do is hand washing. If I don't have a sink nearby, I can use my hand sanitizer. So I'm going to go ahead, get a good squirt of hand sanitizer, and I'm going to vigorously rub that into my hands and all over so that they are clean, and I've given that a chance to work and clean the surfaces all over my hands. And I'm going to go ahead and I'm going to cleanse my surface before I get all my supplies out so that I'm working with a clean surface. So I want to be doing good friction as I'm rubbing that area to get that cleaner into the surface, to get all the bacteria off. And then I want to allow for that to dry before I put all my supplies out so that it's ready to go. The next thing I want to do is go ahead and don my gloves. I've already cleansed my tabletop and set out my supplies, so I'm ready to go. When we're doing suctioning in a person's home where they might be suctioned every hour or more often, being able to keep up with sterile technique isn't possible. So you end up in that situation performing clean technique. So that's what I'm going to be teaching you today. I've performed hand hygiene, I've gotten my clean gloves on, and now I'm ready to perform this suctioning. I go ahead and I turn on my suction machine, and I'm going to let that build up a little bit of power for suctioning. I'm going to grab the end of the tubing that's connected to the canister. I'm going to open my catheter. I'm going to connect to that. The important thing to note about this process is while the machine is on, if this is uncovered, if this little open portal on the top is open, the machine is just sucking air from the environment down into here and then over to the canister. The minute that I cover this hole with my finger, all of a sudden it's sucking through the end of our catheter down here, which is going to suction out the airway. So when this is open, it's going to be just sucking from the environment and pulling it into the canister. Once I close this, I'm creating that suction that's going to go all along the tubing all the way to the end of that catheter to pull out that mucus in that person's airway. So as I'm pulling this out, I can wrap this catheter around my hand, and I like to get it to the point where I've got about 6 inches. That's all the further I'm going to want to go down into the airway. So that's how much of my catheter I'm going to have showing. I'm going to go ahead and let the patient know what I'm doing. Okay, Jim, I'm going to go ahead and suction you now. I won't be doing it for any longer than 10 seconds. And then I'm going to give you a break in between if we need to suction again. So he's aware of what we're doing. I know what we're going to do. When I insert the catheter, once it's down into the correct position, I will plug the hole, and then I will be doing a twisting motion on the tubing as I'm pulling it out. I'm going to do that. That twisting is moving the opening holes around to capture the mucus on the sides of the tracheostomy and in the airway. Okay, so I'm just doing a gentle twisting, trying not to bother the tracheostomy tube too much because that's going to irritate the airway more. So gentle twisting with my finger on this, getting it all done and out of the airway within 10 seconds. Okay, so we're just going to go ahead and put it in there, going no further than 6 inches, covering the hole and slowly twisting over no more than 10 seconds as I'm pulling out of the person. Then I'm going to see how they're doing. I'm going to give them at least a 30-second breather. After that 30 seconds, I can have them try to cough during that process too to see if they can get the rest out. If their SATs remain high and where I want them to be, then I'm not going to go back in and suction that person again. If their SATs are still not where I want them to be, or their breathing is more labored than I want it to be, or there's still a lot of mucus built out, then I can go ahead and suction again. Okay, so I've suctioned this person the first time, and what I can do to clean out the end of the catheter is put it in my cup of sterile water, and I can suck up the water that will clean any mucus out of the tube. Then if I need to suction again, I can start over at this point. As long as I've given that person 30 seconds in between, it's fine to suction again. Once I'm done, I'm going to go ahead, reinsert in the water, suction up a little bit more, and then I'm going to toss this catheter. I'm done with that. I won't be using that anymore, so that will go into the garbage, and then this will go back over to the tank. We've covered suctioning the trach now. We're going to go ahead and talk about removing the tracheostomy and replacing it with another one. That is most likely going to be something that you're going to do monthly for the people you support. There are some times where insurance won't cover it monthly and they'll only cover it quarterly, but for most of the people we support at Dakota Abilities, that's going to be a monthly procedure. First thing we're going to want to do with this is let the patient know what we're about to do. Hey Jim, I'm going to go ahead. It's time to replace your tracheostomy. I'm going to remove the pillow from behind your head. Next thing I want to do is lie the person flat. Okay, that's going to make it easier to do this process and more comfortable at the trach site for what we're about to do. I'm going to make sure that I have access to the tracheostomy, that there's nothing in my way. And I'm going to go ahead and I'm going to cleanse my surface before I get all my supplies out so that I'm working with a clean surface. So I want to be doing good friction as I'm rubbing that area to get that cleaner into the surface, to get all the bacteria off. And then I want to allow for that to dry before I put all my supplies out so that it's ready to go. So this individual, I'm not needing to deflate their trach, so I'm not going to have to deflate and connect to their balloon ahead of time. When I'm ready to remove it, I'll be able to remove it. So to help myself, before I begin, I can undo these trach ties so that when I'm ready to remove the old trach, that's possible. So I'm going to have one finger here holding it in place so I'm not jostling it while I'm removing that tie. The other one I can just pull out from behind and it can be sitting right there so that I'm ready to go. Okay? We've got our table clean, and I'm going to go ahead and get my supplies set up. Got my sterile gloves, got the new tracheostomy. I made sure to check that I have the right size for the person. Tracheostomies can be cuffed or uncuffed. This individual is using an uncuffed tracheostomy. So there's not a balloon around the outside that I need to blow up and test to make sure that there's no air leakage. I've got a new trach tie for myself. Open up my tracheostomy tube kit. I'm going to cleanse my hands. If you have a sink, you'd want to use a sink and warm water. Right now I don't, so I'm using hand sanitizer instead. So I'm going to get a generous dollop of that, and I'm going to rub that all over my hands until it's completely dry. Once it's dry, I'm going to put on my gloves. And I'm following sterile procedure while I do so. Next, going into my sterile container, I'm going to grab the new tracheostomy. And what I want to do in this situation to keep the tracheostomy from getting too bendy while I'm placing it, I'm going to go ahead and put the tube operator in at this time. I'm going to place the tube obturator into the tube. That's going to help so that insertion is easier into the patient. When I'm coming to the patient, I'm going to have my sterile hand. This one will not be sterile once I touch the old trach. So I'm going to go ahead. All right, I'm going to take the old trach out now. So I'm going to be turning and twisting as I go. Notice I'm right-handed, so I'm standing on the right side of the patient. When I start this movement, I'm coming in at this angle, side to side, and then I'm turning as I enter. I've got it placed. I immediately take out the tube operator, and now I can go ahead and place the new trach tie on my patient. I'm going to keep one finger on the trach while I'm doing this so that I don't have any issues with it moving. So I've got the trach tie connected on one side. I'm going to come to the other side. I'm going to go ahead and connect it here, doing my best to keep the person comfortable and minimize any movement to the tracheostomy while I'm in this process. So I've got both sides down securely now. The trach has been replaced successfully. Thank you so much for watching.